Welcome to Angel Health Academy. Topic for the day or topic for the session is impact of illness on patient and family. Impact of illness on both the patient and their family is very significant in any context. Okay, not only in our country but also to other countries, other societies, other caste systems, etc. All have equal significance when there is a disease or illness affected with a particular patient or the family. But in India, certain cultural practices, social aspects, and the economic factors amplify that increases this significant, or this impact. That is the importance of talking the topic impact of illness on patient and family. Because family plays a central role in Indian society. Family plays a key role, an important role in the Indian society. And the illness, whether it is acute or chronic, that affects not only the individual but also the entire or the whole family system. As in Indian society, family plays an important role, and illness, whether it is chronic illness or acute illness, whatever it may be, that affect both the patient and the complete or entire family system or family dynamics or family function. Now let us see the forms of impact. What are the different types of impact? That is forms of impact. There are 9 different forms of impact. First one is emotional impact. Emotional. Second one is financial impact. Financial. Third one is social impact related to societal. Fourth one is impact on family dynamics or family structure or family function. Impact on family dynamics. Fifth one is impact on women in the family. Impact on women. Sixth one is religious and cultural beliefs impact. Religious and cultural beliefs impact. Seventh one is impact on education and career of the family members. Impact on education and career. Then eighth one is healthcare accessibility impact, availability of the healthcare. Healthcare accessibility impact. And last one is psychological and mental health impact or mental illness impact. Psychological and mental health impact. So these are the 9 different forms of impact. So let us discuss in short about all these 9 impacts. First is emotional impact, in that related to or regarding patient. So when a patient is diagnosed with an illness, that may itself trigger the anxiety in the patient, or patient may have fear or a sort of emotional distress. Emotional disturbance in the patient, particularly if the type of the disease is serious or chronic illness like cancer or heart diseases. When a patient is diagnosed with certain diseases, acute or chronic, he may trigger or he may have a certain sort of anxiety, fear, emotional stress, etc. But it may increase if the diseases are such as cancer or heart diseases. And moreover, in Indian context, if it is any mental illness, still it is stigmatized in the society. People have different superstitious beliefs about that. They may not accept the patient and the family members. They may try to isolate the family members. So the mental illness in India still stigmatized. Because of this, the patients or family member may not openly discuss their emotional struggles and other feelings. That further worsening their feelings of isolation, and further it may increase the emotional distress for both the patient and the family. That is the emotional impact of the patient due to any detection of any illness or disease. Second is emotional impact on family. Of course, family members often experience similar emotional stress or turmoil, and caregiver, particularly the spouses, maybe wife or husband or their parents, children, may feel overwhelmed, overstressed by the burden of caring the particular patient or family member. That may lead to experiencing stress, guilt and anxiety, because they have additional duty or additional work to take care of the person who are suffering in the family. And in addition to that, some of the cultural norms of strong family bond. In some cultural practices, family keep a strong family bond. There, the expectation of taking care will be more for the caregiver. So the cultural norm of strong family bonds can lead to high expectation and emotional pressure on the caregivers. Usually the caregivers, as we said, the spouses, parents, children, okay, they have more pressure, emotional pressure and expectation if the family keep a strong family bonds. So this all will comes under impact on family during illness of any family member. The second impact is related to financial impact. In that, first one is medical expenses. Of course, you know that healthcare in India, particularly in private hospital, is very costly, okay, very expensive. And many families lack adequate health insurance coverage of medical insurance coverage, okay, in India at present. Many families lack adequate health insurance or medical insurance. Whereas serious illnesses like cancer, heart diseases, kidney failure or chronic kidney diseases often require long-term care and expensive treatment, okay. For example, dialysis, etc. will cost very expensive for the patient, and it is a long-term, okay. They have to get the treatment for a prolonged period, okay. That all will draining the family savings, that will reduce the family savings. Then maybe family may lead to the debts or liabilities, okay. They have to borrow the money from their relatives, friends, etc. okay. That may lead to debts or liabilities, okay. And moreover, for lower income families, family comes under BPL, below poverty line, even relatively simple treatment itself, they have a major financial strain or financial burden, okay. Nowadays medical treatment is very costly, okay. That is about the impact related to medical expenses on a family and the patient. Second point is loss of income. If the patient is the primary breadwinner, okay, head of the family is the person to go for job and take care of other family members, okay, that is the meaning of primary breadwinner. The illness can lead to loss of income for the family. Then there won't be any other income, other source of income, okay. That exacerbating, increasing the financial problems or burden of the particular family. Moreover, the family members may also have to take time off from their work or job, okay. They have to also take off to take care of the family member or the patient, okay. That also further compounding the financial stress in the family, okay. Third point is cost of traditional and alternative treatment, okay. In India, many people also turn to traditional forms of treatment or practice traditional forms of treatment such as Ayurveda, homeopathy, Siddha, etc. okay, in addition to the allopathic medicine. So there is a tendency that people may go for allopathy, then they may go for a traditional medicines. Sometimes they go along with the allopathic. That all situation that increase the cost of the family members. So these alternative treatments can add to the financial burden or stress on the family, okay. And they may not be covered by insurance for this traditional or alternative treatment. They are only covered with insurance with the allopathic treatment, okay, allopathic medical care, okay. This is about the additional cost for traditional and alternative treatments. The third impact is social impact. In that is stigma and isolation. We are already introduced what is stigma, okay. Stigma lead to isolation of the family and the patient in the society. So in certain communities in India, illness, especially mental illness, HIV, AIDS or cancer may be stigmatized in the society, okay. So society may not accept those people. This can lead to social isolation. So this can lead to social isolation with the patients and their families. They feeling alienated, isolated, okay, loneliness, and they are judged by the society. Then in rural area or where less educated setting, there may be number of misconceptions, okay, about the causes of illness, okay. They believe that illness is from the evil spirit related to past sin, etc. So in rural area, remote area or in the less educated setting, there may be misconception about the causes of illness, okay. That may lead to superstitious beliefs that further causes social ostracism. Ostracism is nothing but the act of intentionally or purposefully excluding the family or the patient from the social activities. That is social ostracism, okay. So that is present in the rural area and less educated settings. These all are the stigma and isolation under social impact. Second point is role reversal and dependency. In traditional Indian families, certain roles are clearly defined who has to play. Okay, but when there is an illness or diseases in the family, that roles are get disturbed. That is that disrupt the structure of the family or the structure of certain roles. Okay, for example, if a father falls ill, his role as the provider in the family may shift to the or transfer to the his wife, or sometimes it may shift or transfer to the children. Okay, that causing the stress or strain in the children or the wife. Okay, and that in total that may change the family dynamics or family complete role. Okay, and moreover is depressed. Okay, because of this condition, because of these diseases, and because of about becoming dependent on other people in the family members, and he couldn't do his role in the family. This comes under role reversal and dependency. So these are the two factors comes under social impact. Next is the impact on family dynamics, complete family dynamics or family function. There would be impact. Okay, first one is caregiver burden of the caregiver. In Indian context, caregiving is often seen in the responsibility of the family members, especially if the patient is elderly or the person is having chronically ill. Okay, so in such cases, a family has to take care of the family members. So caregiving complete responsibility is vested on the family only. Okay, and moreover, this role is usually falls on women in the family. Okay, Indian traditional culture, most of the cases in all the families, any person who suffer from any diseases or illness in the family, the women will take care of the family. For example, the wives, daughters, daughter-in-laws, etc. Okay, who may be managing the household duties, household activities, and even taking care of the children in the family. Okay, because of that, this added caregiving burden, okay, can lead to physical exhaustion in the women. That may lead to emotional burnout, anxiety, okay, emotional burnout, and lack of time for even her personal care and even for the professional growth. So that is the added caregiving burden to the women in the family may lead to physical exhaustion. That may lead to sometimes she may have emotional burnout. Okay, burnout means she may quarrel with the family member, she may have fight with the family member because of the emotional stress, and moreover that may lack the time for her personal care, personal growth, and even for the professional growth. This is about the impact on the caregiver. Okay. Next is tension and conflict. Illness, of course, can create tension within families or within all the family members, especially if multiple family members have different opinions, okay, about the treatment choices or caregiving responsibilities. So in some family, if for example it's a joint family, there are many members, okay, so there the tension will increase within the family member if there is any illness in the family, because there are multiple number of family members, they have different opinion about the treatment of the particular persons, okay, and who has to take care, that also there will be different opinions, okay, that may lead to increased tension within the family members. Okay, moreover, financial strain, emotional stress, and the reallocation of duties to whom has to perform the duties, like that is reallocation of duties, all can lead to disagreement, particularly in the joint family system or joint family members. Okay, so financial burden, emotional stress, and reallocation of the duties as caregiver all can lead to disagreement in the joint family. Okay, that also will increase the tension and conflict in the family. Then third point is children's well-being. So diseases also or illness also affect the children education, children well-being, etc. In households where a parent or sibling is seriously ill, children may experience stress, anxiety, and disruption in their daily activities, daily lives, daily schooling, etc. Okay, they may have to take on the responsibilities beyond their age. Sometimes they have to, there is no other person in the family, they have to do household activities too. Okay, that is their responsibility, that is beyond their age, and that may indirectly affect their education, their emotional development, etc. So if the parents are suffering from any diseases, then children has to take care of the parents. So that may increase the stress, anxiety, and disruption in the or disturbance in their family life or daily life. They cannot go for play, they cannot go for school, etc. Okay, that may lead to emotional stress. Then fifth impact is impact on women. Okay, this point we are already discussed. Under that first one is gender roles. So as we have already discussed, in India women are often primary caregiver for ill in the family members. So if any family members are suffering from any diseases in India, usually the caregiver is the women. Okay, so women are often primary caregiver, important caregiver. They might have juggle to household activities, duties, caregiving of the particular patient, and even possibly professional work. They might have to go for the job. Okay, so they are on the toes to do the household activities and giving care to the patient and even go for the work. This triple burden, okay, these three burden, that's called triple burden, can result in their physical, emotional exhaustion and even depression, and that may be lead to loss of personal freedom. All this triple burden can lead to physical stress, emotional exhaustion, depression, and even that will affect their personal life. Okay, that is the gender roles. Next is health neglect of the women. So women in India, particularly in rural area, may delay or forego seeking treatment for their own illness due to they give priority to their family needs and family problem. Okay, so usually in Indian context, women give more importance to the family and they are more family concerned than their own needs. Okay, that is, they may not seek the treatment in the correct time. Okay, they give priority to the family members. Of course, that is true. Usually, women perceive the illness, all her illness, as a non-serious illness. Okay, but the point is, such as early stage of reproductive or chronic condition may lead to worsened outcome later on. Okay, sometimes it may lead to complication in the later part. Then only she may be giving importance to her physical condition or her health related issues. So one of the important impact on woman is she will neglect her own health because of taking care of her family members. Sixth impact is religious and cultural beliefs impact. Religious and cultural belief. In that first point is acceptance of illness. Many Indian families find solace in religious and spiritual beliefs when faced with illness. Many Indian families are comfort with religious beliefs or spiritual beliefs when they suffer from any problem, when they suffer from any diseases. Some may believe that illness is karma or it is the fate, because of the fate, or it is a karma, they are facing some problem or health related issues which can bring peace. Sometimes it may bring the peace in the family, but it might also delay the seeking treatment. Because of this feeling, because of this belief, they may not get the adequate medical treatment. That may delay the seeking treatment, that may lead to complications. So because of this type of belief, that is, it is due to karma or fate, the chronically ill patient and elderly patients in the family, they accept all the suffering of the particular problem, okay, without taking medical attention or medical treatment. Okay, so this belief can lead to acceptance of suffering without intervention or without medical intervention or medical treatment, especially in case of the elderly patients or old age patients. So this is about the acceptance of illness based on the religious and cultural beliefs of the person. Next is traditional healing practices. Traditional healing practices. Many Indians turn to traditional healing methods such as Ayurveda, Unani, Homeopathy, Siddha, etc. instead of allopathy, either before or alongside with the modern medicines. So either they take before modern medicine or allopathy medicine, they go for the traditional healing methods based on the culture or traditional practices, or even they take along with the modern medicine or allopathy medicines following Ayurveda, Unani, Homeopathy, etc. Okay, so these type of cultural practices are very important in the family. As family decision making, they go for the traditional method or traditional healing practices, but it may delay or it may cause complication for the serious illnesses like cancer or diabetes, because it may not get the evidence-based treatments or modern allopathic advancement treatment. Okay, in such cases that cause a delay and that may lead to complication or death or disability. Okay, that is about the traditional healing practices. Then third point is end of life care. Okay, end of life care is nothing but caring the person who is at the end of the life, okay, terminally ill person or older person. The discussion about death and palliative care, that is a care for the terminally ill patients or end of life care is called palliative care, are often avoided due to the cultural taboos existence of the death in India. Okay, so the people may not talk about the death related care or palliative care and what to do after that. Okay, because we have cultural taboos. So that is not good to talk about that something regarding the death or palliative care like that. So in India, discussion about death and palliative care are very minimum or it is completely avoided because of our cultural taboos or practices. This can lead to families not planning adequately for the end life care of the person who are terminally ill in the family. Okay, sometimes that may prolong the suffering. Okay, it may prolong the suffering of the particular person without proper treatment or without proper palliative care support. So if it is planned well in advance, that may reduce the suffering and they'll get the peaceful end. Okay, so that is about the end of life care. So these are the three factors under religious and cultural belief impact. The seventh factor is impact on education and career of the family members. First one is interruption in education. Okay, interruption is blocking the education. If a child or a young adult in the family is ill, suffering from any diseases, their education may be disrupted, of course, blocked, okay, or stopped due to the hospital visits, frequent treatment, continuation of the treatment, or inability to attend the school because of the particular issue or particular illness or disease. So if the child or young adult is suffering from any diseases, it may block their education because yes, they have to go for the hospital to get the treatment and they have to take the continuous treatment, or sometimes this disease may make them to be in the house indirectly. They may feel inability to go and attend the classes. Then similarly, one of the family member, if they become a prime caregiver for the family member who are suffering with a chronic illness or a terminally ill, their education, their career goals, professional goals, etc. might be in question, okay, or might be put in hold. They also have to stop or avoid in between their education and career, okay, if the person is become a primary caregiver for a long period for a chronic ill person in the family, okay. This is about the interruption in education of the family members due to any diseases or illness in the family. Second one is career and employment impact. Like education, their career also, their employment also affected. In many Indian households, family members may have reduced their work hours or sometimes they quit their jobs. Okay, they stop their jobs to take care of an ill family member. Okay, usually it is our practices like that. So some people, if the parents are ill, the children usually quit the job from abroad or they quit the job from in our own country and they will take care of their parents who are sick or ill. Okay. Of course, it affected the long-term career growth or professional growth of the family member, and indirectly it may lead to financial instability. Okay, that affected the financial stability of the family member, or especially it affected if the person belongs to lower income families or comes under BPL. Okay, so this is how career or employment impact due to illness and sickness in the family or disease in the family. Then eighth impact is healthcare accessibility impact. Accessibility of the healthcare. In that first point is urban versus rural divide. So our health services is different in urban area and rural area. Okay. In urban area, families may have many access to high quality private healthcare services, but it may be expensive. Okay, but they be economically sound. They can have a high quality private, modern, advanced medical care. Whereas in rural area, there is no much access for the people. Okay, so in rural area, access to even basic healthcare services, general healthcare services also is limited. Okay, that is leading to delayed diagnosis, late diagnosis, and even poor management of illnesses. This divide, that is between urban and rural area, that divide can exacerbate, that increase the impact of illness, especially in the people who are living in the rural areas, in rural families. Okay. So that is inaccessibility of the healthcare in the rural area, that is another impact when they face illness and diseases in the family. Second point is health literacy, health awareness. Okay, the lack of awareness. So a lack of awareness about certain diseases, its symptoms, and treatment aspects, or advanced treatment, or primary health care services, especially in the rural and undereducated population or underdeveloped population, can lead to delayed help seeking behavior. So they may not know about that. That's why they may not go to get as early as possible for the particular treatment. Or that may keep reliance on the unqualified healthcare providers. Okay, they go for the unqualified healthcare providers. They have a poor knowledge about the availability of the health services. This type of behavior will worsen or may affect with the prognosis of the illness. It will take more time for the illness to get recover. Okay, that may lead to complication, disability, etc. At the same time, that increases the family stress also, because they cannot cope with the particular situation because of lack of awareness. Okay, because of the lack of education. So this is how health literacy impact the family member when there is an illness or diseases in the family. The last impact is psychological and mental health impact. It includes mental health stigma. We already discussed this point, stigma of the society regarding particular disease. Especially they have a stigma about mental illness in the family. So our society is completely having a stigma about the mental illness. Okay. In India, mental illness like depression, anxiety, schizophrenia, etc. are often misunderstood or stigmatized. People may not be knowing that what is the cause, how it is occurs. They have only stigma, they believe in a different ways. It is because of the evil spirits, okay, like that they believe. So they may isolate the people from the social activities. So for this reason, family may hide the illness. They may not disclose the illness or symptoms of their family member to the society, okay. And instead of that, they seek the religious or spiritual solutions or treatment instead of the professional care or modern advanced medical treatment or professional treatment. These all the practices can worsen the condition of the patient, and that create an emotionally charged and isolating environment for the family. They will keep away from the particular society. Okay. So that means mental health stigma in the society will worsen the condition of the particular patient, and family may have more emotional stress, that is emotionally charged, and they live in the isolating environment and separate from the society and separate from the relatives and other people. Okay. So in this way, mental health stigma impact the patient and family during illness, especially during mental illness and diseases. Second is caregiver stress. So we already discussed about who is the person caregiver and what is their stress. Okay. Caregivers, particularly in case of chronic or mental illness, often experience more stress, more depression and more anxiety than the general problems, general illness or diseases. Okay. So caregivers, especially who care the chronic disease patients and even mental illness, have more stress and more depression. That may lead to depression, that may lead to high anxiety and emotional outbreak. Okay. In Indian context, where caregivers usually are women, often they have multiple responsibility. Women generally have more responsibility. Okay. That means they have to take care of the house, they have to take care of the children. Okay. Sometimes they have to go for the job, etc., etc. Like that, they have multiple responsibilities in the family. Okay. Thus, mental health care of the caregiver is also neglected. She may not mind about her mental status and mental illness. Okay. That may lead to more stress. Okay. Depression and anxiety, etc. This is about the psychological and mental health impact to the patient and family during illness and diseases. So far we have discussed in detail about the various forms of impact. There are 9 different forms of impact when the patient and family suffer from disease and illness. First one is emotional impact. It includes patient emotion and family emotion. Second is financial impact. Okay. Related to medical expenses, loss of income of the family member, cost for other treatment, that is traditional and alternative treatment or management. Then third one is social impact. That is related to stigma and isolation in the society. Then role reversal, role changing in the family member and dependency of the patient in the family. Then fourth one is impact on family dynamics. It includes a caregiver burden, tension and conflict in the family, especially in the joint family, okay, regarding the decision, etc. Then third one is children's well-being, okay. So children's life, children's education also affected, mental status also affected when there is a illness in the family or in the siblings, okay. Then impact on women in the family, okay. So gender roles and health neglect of the women. Then sixth one is religious and cultural beliefs impact. That is acceptance of illness, that their fate, okay, or karma, etc. Then traditional healing practices. Then they may not plan for the end of the life care with the palliative care. That will increase the sufferings, okay. Then seventh is impact on education and career of the family members, okay. That is interruption in education and career and employment impact, okay. Then eighth one is healthcare accessibility impact, okay. Healthcare accessibility, that is urban versus rural divide, okay. Difference in healthcare services availability in the urban and rural area. Then health literacy or awareness, health awareness of the family members. Then ninth, last one is psychological and mental health impact. That is mental health stigma in the society and caregiver stress, okay. So these are the 9 different forms of impact that occur in the family during illness and diseases in the person or family members, okay. So far we have discussed about the various impact of the illness and disease among the patient and family, okay. Hope this video really beneficial in your studies and exam. If you feel it is really worth and beneficial, please like, share and subscribe my channel, and stay tuned with the Angel Health Academy for the next academic video. Thank you.